A problem that's now becoming an increasing issue here in the northwest. New figures suggest Salford is now one of the worst places in the country for those being admitted to hospital having not had enough to eat. Last year there were almost 200 episodes of malnutrition at Salford Royal. That's up from 107 in 2010. But the problem could be much worse, with a report suggesting of the 35,000 people over 65 living in the city, 14% or 5,000 of them could be at risk. Health bosses say they are addressing the issue of malnutrition here in Salford. They've set up a special task force to try and raise awareness and help with prevention. But even so, the figures of people being admitted here for malnutrition are still rising.
I think the fact that the figures are high actually shows how effective that task group has been, because we've been doing lots of awareness raising and training to actually make sure that if somebody is suffering from malnutrition, that it is identified and reported, and then we can actually get those people the help.
But while many of those recorded in those admission figures are elderly or suffering from long-term conditions, there are warnings that poverty and a rise in demand for food banks is also having an effect.
This problem has really hit the roof. And one of the reasons is economy and the policies, the politics. And who has suffered most in this is poor and welfare benefits. And I tell you, you hear heart-rending stories from the patients. They're coming to you for something different. And as a doctor, when you start asking, did you eat today? Did you eat something nourished food and all? And the answer comes, I couldn't afford it. I could either pay my bill or I could feed myself. It's totally unacceptable.
And it's not just a problem in Salford. Figures in neighbouring Tameside are also high. They've now become the first hospital in the country to set up a permanent food bank on site.
We have to try and address this as a public health message, in that the general population are very aware about obesity, diabetes, but again it's that other set of the population that we do need to take care of, our older relatives.
But this isn't just about education. With malnourished patients generally staying longer in hospital and more likely to be readmitted, the warning tonight is that malnutrition could cost the NHS up to £5 billion. Mel Barr.